Welcome to this educational video on nasal rinsing and nasal sprays. Today, we will explore the proper usage of these essential tools for seeking relief from allergies and congestion. Firstly, let's talk about nasal rinsing. So what do you need to perform a nasal rinse? Firstly, you will need a saline solution. We will talk about this more later in the video. Then you will need clean tissues and towels for afterwards. Finally, and most importantly, you will need a nasal irrigation device. There are several types of devices available for nasal rinsing. Some of the more common ones include any type of squeeze bottle made exactly for this reason, a neti pot, or a nasal bulb syringe. Alternatively, if you do not have access to any of these devices, you can use any bottle with a narrow opening. Now I'm going to teach you how to make the saline solution needed for nasal rinsing. The first step is to find a clean cup or bottle with a secure lid. The second step is to fill it with 1 cup of distilled water or tap water that has been boiled and cooled. Now you have the option to either purchase pre-mixed packets at the drugstore or make your own homemade solution by combining a 1/4 teaspoon of baking soda, 1/2 teaspoon of salt, and the water in the cup. Mix all of these together and you can store it at room temperature for up to 1 week. Finally, now we can start performing the nasal rinse. Stand over the sink and make sure you're breathing through your mouth. After creating a seal with the nozzle on your nostril, apply gentle, gradual pressure to the bottom. This whole process can now be repeated on the other side. After repeating it on the other side, make sure to blow your nose. Remember, it's really important to clean the bottle between uses. Why is nasal rinsing so effective? It clears out mucus. It helps moisten the nasal passages that is often exposed to indoor dry air. It removes allergens such as dust, pollen, and other debris. And finally, it thins out stubborn, thick mucus, facilitating its expulsion through blowing your nose or coughing. Do not perform a nasal rinse if you have an ear infection, pressure in one or both ears, a nostril that's completely blocked, or recently had surgery on your ears or sinuses. We can now move on to nasal sprays. A common question is, how often do I have to use my nasal spray? A steroid nasal spray works best when used every day. Your healthcare provider will recommend a daily schedule of numbers of spray for each nostril. Regular use gives you better results. How to use a nasal spray. The first step is to wash your hands. The second step is to make sure you blow your nose. Then ensure to shake the bottle well and take off the cap. Make sure the full dose is being applied by testing it on the air first. Then, hold the nasal spray in the hand opposite to the nostril you are going to spray into. Position the bottle to be pointing at the outer point of the eye on the same side of your nostril while tilting it slightly to the back of your head. Press down and release the dose. Bend forward for 10 to 20 seconds after gently sniffing. This will ensure that the spray goes where it needs to go. Breathe out through your mouth. You are now ready to repeat that whole process on the other side. Remember, Nasal sprays are meant to go into your sinuses, not your throat. If you taste it, then your technique might need work. Please avoid the following when using a nasal spray: sneezing or blowing your nose right after using the spray, skipping doses, holding your head in the wrong position, pushing the nozzle too hard or too far into your nose, and using saline sprays or irrigation after using the medicine instead of before. Side effects may include the following: burning nose, dry irritated throat and nose, an unpleasant taste in the mouth, itchiness, redness and swelling in the nose, as well as nosebleeds. Most of these can be avoided by using proper technique. Do you have any questions or comments? Feel free to contact us on the following email, or alternatively, you can read more on UCT Lung Institute's patient page. Goodbye.